So this is an important slide to talk about what is the most important risk factor for bad outcomes, hospitalization, ICU, and most importantly, dying from COVID-19. This is data from China, reported in the South China Morning Report. It's a busy slide. I'm going to walk you through it a little bit here. This represents children between the ages of 0 and 10, and you can see their case fatality rate when this was reported was 0%. So children do very well with this virus in China. People who are most susceptible to bad outcomes are elderly individuals, where we can see a much higher case fatality rate at 8%. So how does this compare to data in North America? So CDC published this today, and it looks at their cases of COVID-19 from February 12th to March 16th. And we can see here, this is just the absolute number of people who are hospitalized, who end up in a critical care unit, or who die. And again, very similar to the data from China, we can see that if you are under the age of 20, the likelihood of you needing to be in an ICU or die is very low, 0%. Similarly, if you're older, the data is very similar to what we see in China. Case fatality rate much higher, more likely to be in ICU, more likely to be hospitalized. So age is the #1 risk factor for this disease. But there was a bit of sobering news from this data. And if you look at data from 20 to 44-year-olds, case fatality rates are still very low, but we can see there's a significant proportion that were hospitalized, have been hospitalized, and end up in ICU. This is important because later on we're going to be talking about social distancing and keeping yourself safe. And we feel from this data this is also important for people who are in their 20s, 30s, and 40s.